So part of the background is really, we know that there's like $3.7 trillion being spent on healthcare, and that's 20% of the GDP, and that's probably even more now. So this is kind of on top of everybody's mind, especially since we've just come out of a 2-year pandemic. We really need to be more efficient. And with all the staffing shortages, we need to think about how to decant some of that low-value work from the high-value assets of nursing. The AHA describes the hospital or health system whose top executives are ready, willing, and able to make changes to lead that disruptive innovation in the market because they see themselves as advocates for their patients and communities. Improving healthcare cannot be done by continuing to add technology layers that require nurses to just collect more data and spend clinical time documenting and determining how to use the technology to support care. So what problem are we trying to solve? As either a nurse, as a nurse informatics person, as somebody in technology, as a health leader, what is it that healthcare is trying to solve? Well, we want everything solved, right? The grass is green, the skies are blue, the sun is shining. That isn't reality, though. Really, the reality is the work is on the bottom layer. You've got all of these things that you have to keep track of. You have to keep track of capacity, length of stay. You have to worry about providers and nurses with burnout. You've got staffing shortages, revenue, throughput, many, many other things. So even though we would like to believe that the grass is green and everything is wonderful, all of us in healthcare know that there's a lot of work that's done on a day-to-day basis, and that's part of why we have this partnership. So this is why we call this the trillion-dollar problem. You've got the administrative complexity, provider fatigue, and inefficient patient care. So the goal is that we want to try to save some of that and save over $1 trillion per year in decanting some of that low-value work. And now I'm going to turn it over to Betty.
Sure, thank you. So good morning. So I'd like to say that we used the AACN model of the Academic Practice Partnership, and for many of you, you may know that model well. And we thought, why not let that toolkit guide us in establishing an industry academic partnership. And for nursing, that's something new. We really have not, and I'm going to be very frank, as nurses, we haven't necessarily been at the table with industry when decisions are being made. So for us, we thought this was an opportunity. Lisa's CEO and my dean met, and they discussed it, and they turned it over really to Lisa and I to move the partnership forward. So the first thing in establishing the partnership was really looking to see if we had similar missions, because moving forward, we knew that we would need to have similar missions. And as you can see on the screen, we've put our missions together. We knew that, in fact, we wanted to drive better health outcomes, and we wanted to do this as a partnership. We also knew that we were going to have some ground rules, right? We're going to play in the sandbox together. What do we need? So we established some guiding principles of our partnership. We took some time. We really, again, used some of the principles in the academic practice partnership to guide us in thinking that we needed to have not only a mission and vision, we needed guiding principles, and we needed a framework to work from. So our guiding principles were that our collaboration should align both of our organizations' missions and objectives. That we would focus on an topic of high need in the practice arena. We would build on lean process, design thinking, and system engineering principles. Not really any of those are touched on in curricula, but they're literally simply just defined in a curricula, in today's nursing curricula. So how do we enhance that as a partnership? We also believed that we wanted to improve key drivers in our health system's success. We wanted to demonstrate a reduction in operational costs. So again, financial outcomes were important to us. And obviously, most important was to improve care.